Hi everyone, my name is Melina and I'm doing my PowerPoint presentation about upper respiratory infections. What is an upper respiratory infection? A URI is an infectious process of any components of the upper airway, which includes the sinuses, nasal passages, pharynx, and larynx. Infections within these areas can be specifically named. For example, rhinitis, which is due to an inflammation of the nasal cavity; sinusitis, which is an inflammation of the sinuses located around the nose; nasopharyngitis, also known as the common cold, is an inflammation of the nares, pharynx, hypopharynx, uvula, and tonsils. URIs are the most frequent causes of doctor visits with symptoms like runny nose, sore throat, cough, and breathing difficulty. Although upper respiratory infections can happen anytime, they are most common in the fall and winter months. What are the causes of URIs? Most often because of direct invasion of the mucous membrane of the upper airway by a virus or bacteria. Their method of entrance is fighting through the mucosa of the airways through numerous physical and immunologic barriers. For example, hair inside our noses acts as a physical barrier and is able to trap the invading organisms. However, viruses and bacteria are able to resist defense mechanisms by producing toxins to damage the body's defense system, or even use a disguise from being recognized by the immune system. And now for the big question. Are URIs contagious? Absolutely. Upper respiratory infections are considered contagious and spreads from person to person from methods like inhaling respiratory droplets from a cough or sneeze. For example, this picture I provided. It can also happen from touching the nose or mouth by hand or other objects that are exposed to the virus. The most common symptoms include runny nose, nasal congestion, nasal discharge, sneezing, scratchy throat, coughing, painful swallowing, and fever, which are most common in children. Bad breath, poor sensation of smell, headache, short breath, nausea, itchy, and watery eyes are considered to be the less common symptoms. These symptoms can vary and last from 3 to 14 days. Rest is one of the most important steps of treatment. Daily activities such as working and exercising should be liked. Increased water intake is advised to keep up with the fluid loss from runny nose. The most common treatment is acetaminophen, like Tylenol, can be taken to decrease fever and aches. Cough medications and honey mixed with warm water can reduce cough. Decongestants like Sudafed can be used for nasal congestion. However, they are not recommended for children less than 2 years old. Antihistamines like Benadryl can help with decreasing nasal secretions.